Good morning, everyone. Thank you for joining our webinar today. My name is Sydney Powell, and I'm in the marketing department here at Revele. I'll be the organizer of today's webinar, and we are super excited to have you on the line. We have some great information lined up on all things MIPS 2021, but before we get started, I just have a few reminders. We'll be recording this webinar, and I'll make the recording and the slides available after the webinar. We also have some time set aside at the very end of the presentation for questions. So if you have any of those, we'll get to those at the end. So moving forward, I'd like to introduce you to our presenter this morning. Krista K. Sultan, MS BSN, has dedicated her career to improving the healthcare industry for healthcare companies, professionals, and patients alike through education and organizational management. Prior to joining the team at Quantician as VP of Value-Based Strategy, Krista served in executive positions for companies such as Great Lakes Caring Home Health, Wellbox, and Citra Health Solutions. She's respected in the industry for her high clinical aptitude, innovative program development, and unparalleled client relations. Krista holds a master's degree in biomedical sciences with a concentration in behavioral neuroscience, a BSN degree in nursing, and a bachelor's degree in psychobiology with a concentration in neurobiology. Krista's research background is in developmental neurobiology, and her work has been published in the Journal of Comparative Neurology. Following her time in research, Krista pursued a career in nursing, where she gained invaluable clinical expertise in women's health, obstetrics, medical surgical studies, apologize about that, and neuroscience that inform her work today. Krista lives in Bryan, Texas with her family. She enjoys hiking, a good cup of coffee or three, and keeping current on all things neuroscience. And then to give you a little bit of background on Quantician, Quantician is a CMS qualified registry that helps medical groups track, report, and improve on quality performance in each of the CMS quality payment programs, MIPS, and advanced APMs. Quantician provides modern technology along with a supportive team of experts that help guide our partners to success. Revele has been working with Quantician for almost 4 years to provide MIPS and APM reporting software and services. This partnership has consistently produced strong results for Revele's clients using this platform. The CMS quality payment program is made simple because of Quantician's ability to seamlessly integrate with eClinicalWorks and expand upon the quality measures supported. So really excited to have them on today. And then I'm sure there's a few people on this webinar that might wonder who we at Revele are and what we do and why we're presenting on this topic. So to explain Revele a little bit, we're one of the few end-to-end revenue cycle solutions built for eClinicalWorks users who want an integrated, data-driven, and dependable service. Unlike other RCM solutions that leave your in-house staff following up on claims and answering patient phone calls, Revele offers the expertise, scalability, and efficiency healthcare leaders need to build a richer revenue cycle in a rapidly shifting healthcare environment. We take a team approach to our success. Revenue cycle management automation is meant to support our solutions, not replace it. We assign our clients a client success team lead by US performance managers, and these team members come with years of experience dealing with RCM challenges and are here to help serve the day-to-day needs of customers. You can also expect to work with a billing consultant, coding consultant, team leads, and eClinicalWorks certified trainer, among other members supporting the RCM process, which also includes certified coders and patient service representatives. As a revenue cycle management service, our goal is really to be a partner with our clients. We know MIPS can be challenging, and we know that healthcare has changed dramatically, and we care about your success and want to give you our knowledge and experience to upcoming changes, like our topic for today's webinar on preparing for MIPS challenges in 2021. If you have questions about how we can help our clients keep up with the industry changes and increase cash flow, we'd like the opportunity to connect with you later on. So now what you've all actually been waiting for, I'm going to pass it over to Krista.
Thank you so much for that introduction, Sydney, and thank you to all of our participants that have joined the webinar this morning. We're going to be covering changes to the macro program for 2021 with a particular emphasis on the updates to the MIPS program. So as a brief overview of today's agenda, we'll be going over the core updates to this program for 2021, including new category scoring and weighting, new performance requirements, the increased potential for a penalty or bonus payment, as well as touching on the advanced APMs available as an alternative to the MIPS program. So thank you all for joining us. I'm sure that all of you at least have a cursory understanding of the merit-based incentive payment system, or MIPS program, that is one of the two pathways available through the macro quality payment program for providers or organizations that bill a minimum threshold of Medicare Part B payments. The performance year for the MIPS program starts in January and runs throughout the calendar year, although there are some requirements, some categories that do not require reporting the entire calendar year. I just wanted to touch quickly on one of the minimum reporting requirements that often causes confusion for some providers. And when reporting for MIPS, there is a requirement that in order to meet the program guidelines, you must report on a minimum of 70% of all the data available for that particular measure. This is not specific to Medicare Part B in this case. This means all encounters that are applicable to a particular measure that has been selected for reporting, regardless of who the payer actually is. So now I'd like to go ahead and get into the particular updates to the MIPS category scoring for 2021. The first category we'll touch on are quality measures. Quality measures are probably the category that most providers are comfortable with because these are measures that have been around for quite some time. They evolved directly from the legacy PQRS program, and there's a similar version of these quality measures that persist no matter who the payer is. So these are measures that look and feel familiar. They're your mammograms, your colonoscopies, and the things that probably by now have become ingrained in your practice. Unfortunately, it wouldn't be CMS unless they were pushing the boundary and continually making things more challenging for providers to adapt to. So with the quality measures, we're seeing a decreased weighting as the overall trend for this category. So while last year in 2020, this category was worth 45% of your total overall score for the program, this year it's worth 40% and will likely decrease again next year for 2022. The next category is promoting interoperability. So this is the category where we're asking you to exchange data throughout the healthcare continuum. So exchanging data electronically outside of your particular organization. You do have the opportunity to select which objectives you would like to submit. But of course, you do need to be using a certified EHR at this point. So promoting interoperability, the guidelines for this category are still pretty easy. This is one where you're only required to submit for a 90-day period, and you can choose which 90-day period you would like to submit before. This weighting is staying steady at 25% of your overall score. And there's a similar trend with improvement activities. So again, you can select which areas of your practice that you would like to evolve and develop on some of these improvement activities. Many of them have their own separate reimbursement structures. For example, chronic care management, remote patient monitoring, and the like. So this, again, is holding steady at 15% of your entire score for MIPS, and only needs to be reported on for a select period of your choosing. Last but not least, we have our cost measures. And this is something that kind of evolves back to the entire overall picture of value-based medicine in general, that we're measuring quality and cost and raising the bar on both ends of that spectrum. So the great news with cost measures is that you don't have to do any particular reporting. CMS does it for you based on the claims that you're submitting. However, this one is picking up the slack where quality measures left off and is weighted an increase of 20% this year, and that increase will likely continue in 2022. So unfortunately, it looks like the trend of being comfortable staying uncomfortable is going to continue for quite some time with this program. I did want to touch on the 12 quality measures that were removed. Again, the quality measures category is one that feels very comfortable for most organizations. You can probably cite the top quality measures from memory, including how you need to document those measures within your electronic health record in order to receive points for those measures when they are completed. But every year there are some subtle changes, and this year is no exception. So there are 12 quality measures that have been removed. So if you had previously selected one of these measures, you'll want to choose an alternative moving forward. The next area that I'd like to take a look at are the payment adjustment thresholds. And this is where things start to get particularly challenging this year. As if we hadn't had enough with 2020, 2021 is bringing us new challenges by significantly increasing the penalty avoidance threshold. So simply put, your penalty avoidance threshold is the minimum score that you would need to receive when submitting for MIPS in order to avoid a payment penalty. That penalty avoidance threshold has been increased from 45 to 60%, making it significantly more challenging for providers to avoid a payment penalty. To add insult to injury, the penalty amount can increase to up to 9%. So this is a 2% increase in your potential payment adjustment from what we saw in 2020, which of course was a 2% increase from what we saw in 2019. Now, when this program was initially laid out, I'm sure you'll recall that the program was set out for a couple of more years in advance, and this is the maximum payment adjustment that maps back to those original programs. But that doesn't mean that you can get entirely comfortable with it. So again, these are changes that are definitely here to stay, and at this point, need to become part of the core expectations that you have for your practice in order to be successful as a business providing healthcare in this modern age. Now, if your score, your overall score for MIPS, falls between 60 and 85%, you actually go from that penalty avoidance threshold to having the potential for a positive payment adjustment. So that bonus is up to 9% based on where you fall within that positive adjustment range. There is still the possibility for a top performer adjustment wherein that payment bonus may be increased by a factor determined by CMS for providers that have scores over 85%. So there is still opportunity with this program if you make the necessary changes to the way that you're doing business and providing care to have this be a positive experience for your organization to increase the reimbursements that you're getting. So just to kind of look at what that picture looks like, we know that the eligible provider criteria work off of a minimum value threshold, wherein you need to see a minimum either number of patients during their performance year or submit a minimum dollar amount in Medicare Part B claims. So for 2021, that minimum threshold is at a minimum of 200 Part B patients per provider, or a minimum of $90,000 in billed services for Medicare claims for the organization that you're submitting under. So if we look at the potential financial opportunity, it becomes quite significant when we start extrapolating the math. For example, an organization that bills up to $1 million annually, getting a 9% bonus, that translates to $90,000. Depending on where you are in the country, that might mean bringing a nurse practitioner on salary or an additional LPN or a couple of medical assistants to help out the team. It could mean an investment in telehealth platforms or other services that help with patient engagement and retention, which again feed back into that positive cycle of building on one another as far as increasing not only your success, but the outcomes for your patients as well. So let's look at the overall MIPS timeline. I wanted to touch on this because it can be a little bit confusing, although the way that the timeline plays out has not particularly changed. Again, we touched on the fact that for the MIPS program, the performance period is a calendar year. So it begins January 1st and runs through December 31st. Even though there are times that you're selecting a subset within that for some of those categories, that performance period is set on the calendar year. So the way that the program timeline works is the performance period runs up through the end of the year, and then you get through the end of the first quarter of the following year to submit your data for the categories that require a manual submission, or I apologize, an automated submission from the program. So those three categories other than your cost category. Once that is submitted, the data is processed by CMS, and then the payment adjustment goes into effect the following year. So basically, there's a 2-year buffer. The performance for 2021 is going to be playing out in 2023 when we're talking about the actual payment adjustments that have been earned. So this is something that if you earned a positive payment adjustment of up to 5% in 2019, you're going to start feeling that this year. On the flip side, if you earned a negative payment adjustment, you'll also start to feel that this year as well. And if you're going to continue to practice medicine, this will be something that will become an evolving trend that you'll need to maintain, again, in order to be successful. Most outpatient provider organizations operate at a profit margin of about 15%. So when we start looking at things like adjusting your total reimbursement by 9%, that's an adjustment that's significant enough to determine your ability to stay in business and provide care to your patients. And of course, I know that we're only talking about Medicare Part B at this point, but we all know that where CMS goes, so go the commercial payers. Again, I did want to touch briefly on the advanced alternative payment models. So under MACRA, in that quality payment program category, you can either choose MIPS or you can choose an advanced alternative payment model in order to qualify for this program. And it seems that each year there are a couple of more options as far as the alternative payment models that are available. So the reason I wanted to touch on this is because with each of these programs, there are a unique set of requirements for participation in the program. There are different facets of day-to-day reimbursement, as well as quality metrics and the potential for positive payment adjustments. And it can be a lot to manage all of these things. So at Quantician, this is one of the things that we specialize in, is understanding each one of these programs in detail so that we can put together an entire workflow picture for your organization that helps you meet the needs for your business and for your patients, no matter which program you're participating in. Some of these things, such as the newer kidney care program, or for instance, ESRD programs, can be quite specialized, but that is something that we can help guide you through. So all of our solutions are going to focus on starting with analytics and collecting data from a myriad of different sources, beginning with your EHR, but continuing through things like health information exchanges, pharmacy claims data that might not otherwise be available, connecting with other organizations throughout the care continuum in your community, such as home health providers or skilled nursing facilities that might capture your patient after a hospitalization or specialized need for care. And we can help you put together from an analysis of the data that is specific to your practice, workflows that will help you maximize across each of those specialized patient populations. And then lastly, an important component of that is that data exchange piece of the puzzle. Having not an integration with every single piece of technology in the market, but choosing the right integrations that make sense for you and that feed into the type of work that you're already doing with your patients. So again, data and analytics is something that has been such a buzzword in value-based care that it's almost become passé to talk about it as being new and innovative. But it's still a basic tenet of succeeding in value-based care that you need to begin by looking at your particular patient population. And from that data, you need to be able to extract actionable insights that will give you a starting point of how to adjust your processes or how to fine-tune which parts of your patient population need most of your attention. And that brings you to streamlining your efforts so that you're not trying to do everything for everyone, and you can focus on the patients that need you the most. And then last but not least, once you've done all of that, you want to make sure that you're getting full credit for it. I can't tell you how many organizations have healthcare providers that know which patients need to receive a mammogram. They know which patients need to receive a colonoscopy or a flu shot every year. But if you're not documenting it in the proper way, or you're not submitting that data in the way that CMS would like for you to submit that data, you're not getting full marks. So again, our solutions will allow you to maximize those opportunities by having dashboards that make it quick and easy to see how you're doing, and then also providing recommendations on where to get the most bang for your buck. So when you are exerting the type of effort that requires you to pay attention to quality scores over direct patient care, that you're doing it quickly and easily so that you can get back to the business of actually providing care to your patients. And then, of course, making sure that our solution is one of those solutions that can easily integrate with your EHR. So, for instance, we have an existing partnership with eClinicalWorks, and we have a number of customers live now where we have an integrated solution, which means providers aren't having to log into a separate dashboard to get real-time insights that they need in order to know which gaps to close the second the patient is in front of them in the exam room. We also have artificial intelligence that will actually go through and read the text data that's available in your electronic health record to be able to pull out data that was previously invisible to analytics engines in the case that it comes in the form of text format. So we do have that NLP OCR technology that can actually go in, read notes, read diagnostic reports, and extract the information that you need in those cases as well. So all of these solutions can partner with one of our subject matter experts to help you figure out the format that will be most successful for your practice. But I think the best way to help you understand what we can do for our customers is to look at our past performance, because of course, past performance is the best indicator of future performance. So if we're looking back at 2019, which is the most recent performance year we have accurate data from, because of course the 2020 submission period is still going on, our average provider score for 2019 was 88.5. That means that our average provider exceeded the exceptional performer threshold by more than 10%. That also translates to the fact that 100% of our Quantician providers not only avoided a negative payment adjustment, but earned a positive payment adjustment. So I think probably the best way for me to illustrate what it is that we can do for you is to take a few moments and look at one of our demo dashboards to help show you what a typical snapshot of your data would look like with Quantician. So this is our demo environment. And when you first log in, we're looking at the individual provider profile for Dr. Gregory House. I'm sure all of you are familiar with that famous internist. And this is giving you Dr. House's overall MIPS score for 2021. Of course, it's not very high yet, but give the guy a chance. We're still in February. Below the overall score, we can see the different categories for MIPS broken down individually. So we, of course, have quality, promoting interoperability, improvement activities, and resource use or cost. So we can drill down and look specifically at how he's doing with quality measures by looking measure by measure. This snapshot will not only tell you which individual measures are at play, but it will give you the number of eligible patients that are within your practice. And then of the patients that have been seen so far by Dr. House, how many times he closed the gap where needed. And then, of course, you can drill down by specialty and also look at the particular measures that your practice has selected for submission. We can also get a quick and easy snapshot of the global performance of a particular measure. And if you're unfamiliar with the measure specification guidelines, we have included the measure guidelines for each measure right there in the program, so you can quickly and easily download it, see which patients this measure applies to, the exception criteria, and of course, the all-important understanding of how you need to document that measure properly in order to receive credit for the work that you're already doing. But Quantician makes it a little bit easier by giving you this particular encounter view. So if you had not already included those performance met criteria, you can simply select an encounter and attach the correct code and go ahead and submit that code right there and then. So that's just one of the ways Quantician can help providers get the types of insights that they need. Another valuable part of the process, in addition to looking at the individual scorecard, would be looking at the overall recommendations that Quantician can provide quickly and easily. So if we go to the recommendations tab, we can see how each individual measure, should be selected, has the potential to impact our overall MIPS score. So you can make sure that when you're choosing a measure for selection, that it's one that has the potential for providing the most impact. And you can quickly and easily see how many eligible patients you have within your practice at a glance. The application also allows quickly and easily for your reports to be exported as either a PDF or spreadsheet file. And we also provide your daily huddle sheets so that you can look at your schedule, which patients coming in are included in the program, and the measures that apply to those patients so that you can close them quickly and easily. We also have the ability to load educational webinars so that as we continue to perform updates throughout the year on reporting guidelines, trends in quality reporting metrics that apply to your organization, we can load these so that each provider in your organization has the opportunity to watch them when it's most convenient for them. And then, of course, if this were live data, you can keep a tally of the submissions that have already been done. Unfortunately, we don't have those because this is still a demo environment. So that's a quick and easy snapshot of the Quantician panel. And now I would like to toss it back over to Sydney, and we can open up the line for questions from each of you.
Great, thank you so much, Krista. That was a lot of really awesome information. So for any of you who thinks you may have missed something, don't worry. I'll send you an email later today with the slides and a copy of the webinar recording. So like Krista said, we will open up the floor for any questions in case you guys have anything that you'd like to ask. And as we wait for those questions to roll in, I want to make sure that you guys know how to get in touch with us if you'd like to learn more about any of our services at Revele, any of the services at Quantician, or would like follow-up information on anything. So following the webinar, you'll get a quick survey. You can let us know how we did or request for one of us to get back in touch with you. You can also simply reply to one of the follow-up emails from our team, and we will move quickly to see how we can best help you. And that again goes for more information on Quantician, or if you'd like to schedule a personalized consultation with someone from their team, just again, reach out to myself or someone on their team and we'll get you connected. So let me see here if any questions are coming in. I'm seeing one, Krista. So do providers have to report data on all patients or just Medicare patients?
So for the measures that have been selected for the MIPS program, they do actually have to submit data on all available patients, meaning not just Medicare Part B patients. So within the confines of the denominator criteria for that measure, so a lot of times those denominator criteria are going to specify an age range or a particular sex or pre-existing medical condition in order for that measure to narrow down that denominator population. But one of the denominator criteria is not going to be that the patient has Medicare Part B coverage. So you will need to report on at least 70% of the encounters across patient payers. So thank you very much for that question, because that is a kind of a snagging point for a lot of providers, and I can understand why, because it's kind of confusing to have to report quality metrics to a payer, even if the patients do not apply to that payer.
Great, yeah, thank you. I see another one in here. If I don't report any data, what happens?
So if you meet the minimum threshold as far as Medicare patients, either as an individual provider or for your organizations, and you don't report any data, you will not receive a score that puts you in that threshold to avoid a negative payment, which means beginning in 2023, all of the reimbursements from Medicare Part B encounters will be affected by a negative 9% payment adjustment.
Okay, great, thank you. I see another one in here. So what if you are in an ACO?
Great question. So with our ACO patients, you're generally going to be reporting your data through the ACO. So you're still reporting on that data. The difference is typically the ACO is doing it for you. So you don't necessarily get out of reporting on these quality measures, but you're reporting them via another pathway, and you kind of shift the emphasis. However, one trend that I've seen with a lot of ACOs is that in their financial agreements within a particular ACO, we're starting to see more stipulations of how individual providers or individual practices within the ACO are making that quality data available to the ACO because of the amount of work for the ACO when it comes time to submit at the beginning of the year. In fact, all of my friends that are currently working for ACO enablement firms have suddenly become unavailable as they go into quality submission time. So again, that data gets submitted, but it's done by the ACO, and I wouldn't get too comfortable if your ACO is doing it for you, because you might see more caveats and contingencies coming your way soon.
Great, yeah. The last question that I'm seeing roll in right now is, how can I see if this would be a good solution for my group?
I think the best way to see if this is the right solution for you is just set up a time to chat with either myself or one of my colleagues. And what we can do is we can talk about the different kinds of payment contracts for your organization and what a Quantician solution would look like. So one of the benefits is that the implementation of this solution looks a little bit different for everyone, because while today we're talking about MIPS, I also want to make sure when we're talking to customers about how we can help them, that we're taking into account their Medicare Advantage plans, their typical commercial plans, as well as any advanced payment models or ACO agreements that are at play, to make sure that we have a solution that enables all of those things, so that you're not just successful in MIPS, you're successful in all of those risk-based or value-based contracts.
Great. Yeah, that's awesome. Well, it looks like that was all the questions that we had for now. So thank you again so much, Krista, for chatting with us and giving us all of that really amazing information on MIPS. For everyone on the line, if you have a quick minute, be sure to complete that survey right after exiting the webinar. We'd love to get in touch with you if you have any additional questions or feedback. So yeah, thank you so much for taking the time to join us for an hour on all things MIPS 2021.
Thanks so much for having me.
Bye.